morning, everybody. I'm Jillian Cohen, and I'm the CEO and co-founder of Virtual Health Partners. Virtual Health Partners is a live virtual nutrition, lifestyle modification, and fitness company. It's somewhat apropos, the discussion I'm going to have today after Mark and Bill's discussion on why aesthetics has not really adopted telehealth, when aesthetics is usually very early adopters within a field of anything, as we all know. So the question is this telehealth a friend or foe for the aesthetic marketplace? So first of all, technology in everyone's lives. I'm sure everybody is looking at their phones at some point during this talk, very normal. And probably all of you have used at least one, if not probably 5 or 6 of these apps on your phone today. They're ingrained in your life. You use them for everything. We like them because it gets us where we want to go. It gets what we want immediately into the palm of our hands. And it also allows us to socialize and keep track on what celebrities are doing, our friends are doing, who you went to high school with is doing, right? I like these apps because I actually met my husband by swiping right. So, I have a near and dear in my heart to virtual apps. And also the fact is that it's somewhat apropos that I'm a CEO of a telehealth company. So, how is it that we can take technology and it's such an integral part of our lives? And how is it working and why telehealth becomes such an important field? So when we think about telehealth and how it's really integrated into medicine, it's allowed rural communities to now access care. It's allowed real-time video consults for even ER visits. It also allows for patient monitoring, heart rate, et cetera, and even Apple is doing studies with the heart rate monitoring, as you all know, with Rush and other large institutions. So we also have that whole concept of data storage, right? And data. It's a huge factor in today's world, and it enables us to be able to collect data and utilize data to improve outcomes and care. So we also have that ability to instant message. That's what we all do all day long. I don't know if you've ever been with any teenagers in a car, but they don't even talk to each other. They text message each other while they're in the back seat. So, as we think about that, it's also really about the fact that it provides tools and education to help improve outcomes, but also engagement rates. And what this has all told us is the fact that this has led to improved satisfaction across the board. 97% of patients are more satisfied, and this is across multiple surveys and clinical publications, when there's a telehealth offering for them. What it really leads to is the satisfaction is because we live in a society when everything is on your phone, where any of that care that you want to access or that Uber that you want to get, which I'm sure a majority of people probably took here today, you don't want to stand there waiting to hail a cab. You want to have that Uber in front of you when you're walking out of your hotel door. So it's the same thing, right? Hospital systems have realized that in the past 4 or 5 years, they've grown from 50% to over 75% of hospital systems incorporating telehealth into their offering and their services. And so U.S. News and World Report did a large study about what percentage of the patient demand that's out there wants telehealth services in their life, and it was 74%. We also know that JAMA conducted a large multi-center trial with veterans in which they showed that it was over 71% of veterans wanted telehealth services, and it's an older population. So insurance companies like telehealth, right, because of that cost savings piece up there. However, there's a flip side to it where physicians that we know who work with telehealth like it because that $45 is an additional visit that they can add into their in-office visit on top of what they'd make in office, and also lower reduction of overhead because there's no staff involved in seeing that patient. But the key component to all of this is really access to care. People want access to care when they want it, how they want it, and exactly what it is that they want, we're still learning and figuring out, right? But we know that they want to see their primary care physicians. That's one component of it. But they also want to be able to text into their dermatologist a picture of their rash, which we know is becoming a larger and larger trend. Or they want to be able to access ancillary services that they wouldn't already or otherwise be able to access, such as nutrition and lifestyle modification, which can improve the outcomes. We've seen that in studies with Dana-Farber on oncology. We've seen that even with our own studies that we've conducted with virtual health partners, with liposuction and intragastric balloons. But we also know that industry is catching on and realizing that they don't want to just offer a product. They want to offer a full solution, because what does that full solution lead to? It leads to the companies being able to sell more of their product because they can keep the user on the product for longer. So, the traditional model in today's day and age with aesthetics is all in office, right? Liposuction, breast aug, injections, laser, everything is in the office. So if there's anyone out there who can figure out how to give an injection through a phone, you're definitely the next unicorn of Wall Street for sure. But I think there's another way to be able to tap into this $16.7 billion projected industry, and it grows every year with these projections. So how can aesthetics do that, and do you believe that they can, when it's such a vital piece of having that patient in the office to perform these procedures? And of course, I'm a tech CEO, so I do believe it's possible. And the way in which I think you can really do it is we have a case study where we saw a young plastic surgeon. She actually was having trouble growing and closing business, in a large practice. And she actually implemented doing a virtual appointment with her patients before, as their initial. And what she saw was she almost increased her closure rates 3 times. And she also reduced her overhead costs because she didn't have to have staff involved in seeing that patient population. This is extremely popular with the millennials. When we looked at the age group that she was servicing, the average patient age was 27.3. We also know that you can differentiate your practice, right? And you can engage. But more than anything else, this becomes a new line of revenue that can be offered, just like skin cream, where you can offer live virtual services, whether it's your staff or it's nutrition or lifestyle modification, to increase these outcomes. And that's what we've seen with virtual health partners when we looked at the case study and how it was overall done. And so we've seen improved outcomes, we've seen improved retention rates, and also improved patient satisfaction, which is key to the renewals and to keeping patients coming back over and over again. So I thank everybody today for your time, and look forward to any questions.